We've talked a little bit about food, and we've talked about things like secondhand smoke. What are some of the other environmental factors that you discuss with patients? I'm thinking even mostly about like s- uh, pollution and particulates in the air. These are kind of areas of research that I don't think a lot of people know about, depending on socioeconomic status. There's maybe a factory nearby somewhere. Are those conversations being had with patients, or is that staying mostly in the research world?
It's very difficult to have that conversation with patients because in that small snippet of time that a provider might have to have a discussion, there's a lot of information that needs to get covered. And there's also a lot of information that we might not even either know about or ask about. So developing different risk scores for different zip codes is something that we can do as a healthcare industry, so that we start to understand those different environmental factors. I love the fact that you brought up pollution and your proximity to, let's say, like a factory that's polluting the air or the water, or something of that nature. Those are factors that we don't necessarily take into account when we're having these discussions with our patients. And then even when we're looking and we're examining the different outcomes that we get at the end of the healthcare journey or at the end of the delivery, those different factors are oftentimes not taken into consideration at all. And I think that we need to.
Interesting. Are there any other systemic barriers you see affecting women in underserved populations, and which clinical practices have you come across or technologies that are effective, if any, in overcoming them?
I think one of the largest barriers, it sounds very basic, but it's actually the idea of self esteem. It's the idea of imparting the knowledge and the wisdom that you are worth everything in the entire world. There's nobody more important than you when you're having that discussion with your provider, and you shouldn't take no for an answer. You shouldn't take confusion for an answer either. If there's a question that you have as a patient, being able to empower you to ask those questions and continue to push until you actually get the answer that you deserve is a skill that is not often taught to anybody. So, especially when it comes to a cultural difference, everybody has their own backgrounds, and I also know that every culture has its own proclivities as well. It's not a bad thing; it's just the way that things are. And some cultures are naturally more inquisitive, and they press and they push a little bit more than other cultures who might just accept an answer for being an answer. I think that there's a middle ground that we need to strike there somewhere so that people understand that if you truly don't understand, tell us that you don't understand so that we can explain it a different way so that you are able to actually understand it.
Yeah, this is a conversation that I'm seeing across the board, especially when people are even asking questions on places like social media, it's where it's almost like, how do you know what to ask your doctor if you don't even know what your options are?
Mhm.
How are you finding that patients are able to gauge the quality of care that they're getting? Are people going to usually one source, or is it just if you don't have a doctor in the family, then you just kind of have to rely on what you're told by your physician?
Difficult question to answer.
Mhm.
I think people get their information from a lot of different sources. It used to be, I'm going to date myself a little bit, but it used to be WebMD was like the big thing that people always used to go to. Now it's Google, now it's ChatGPT or Gemini or something of that nature. Again, it's not a bad thing. I think having the understanding that the information is out there and everybody deserves to know this information. Nobody should really have a monopoly on that discussion. That's first and foremost the biggest thing to understand. But I think my wish would be that people would do more research on their own, actually,
Mhm.
and come to their providers and their practitioners with more, succinct questions and concise questions about what is actually bothering them about either what's they're going through right now or what questions do they actually have that they wish that somebody would explain the answer to them. Um, Again, like I don't think people do enough of that. And as the information superhighway, so to speak, expands at an exponential rate, that's one of the things I think is going to be challenging for physicians. But I think it's a challenge that we need to take on head on.